a lot of people think light is just here to help us see,
Sure.
but there's actually a lot more to light. So for example, when I shine this light on my arm here, it's not just delivering light, it's delivering energy. And what this is doing, the light is actually traveling through my skin, going into the cells.
Interesting.
And red, near-infrared are the two wavelengths that can travel through skin into the tissues. And at that level, what it's doing is it's activating the powerhouses inside of our cells, the batteries. So now when the batteries inside the cell have more energy, the cell can function better.
Interesting.
And there are actually lots and lots of studies and very well done, high quality studies, systematic reviews that have looked at the effects of red light therapy in painful conditions like arthritis, tendinitis, lower back pain, that have shown a benefit of red light therapy in these conditions. And the main reason is that at that cellular level, it's helping to reduce inflammation. So it's blocking the inflammatory pathway. A lot of people know that turmeric is anti-inflammatory.
Sure.
And it does that by blocking the inflammatory pathway. So it's stopping messengers, chemical messengers that are activating these pain fibers.
Wow.
And red light therapy does the same thing.
And why red light? Why not blue light? Why not green light? What is it about red light that makes it work so well?
It's because on the mitochondria, the powerhouses, the batteries inside the cells, we have receptors. So there are these antennas that pick up the frequency of red and near-infrared. And also, those are the two frequencies of light that travel through skin the best. So blue, green, they kind of get deflected or they're absorbed by the cell, so it doesn't really penetrate through the skin and get into the cell.
And what are some of the conditions that red light therapy really works well with?
It's going to sound like snake oil, and that's why I was skeptical at first. But because if you think about how it works, it's tackling that root cause of many conditions, which is the lack of energy in the cell. It actually has been, there's a lot of evidence that it can help a wide range of conditions, from rejuvenation, so anti-aging for skin, prevent wrinkles, to wound healing. So it can help wounds heal, pain, inflammation, sleep, mood support, and even brain function. So studies are now looking at how it can help with dementia, Alzheimer's. So yeah, it has a wide range of function.
And it looks like you have a portable device there. Like, where does one get red light therapy? How, it seems like that's something you could purchase, or?
Yes, so it's now with LED-based devices, is a lot more accessible to consumers, whereas before we could only use laser, which is only accessible to healthcare professionals. So yeah, you can buy these portable units, which are better for kind of targeted treatments. And then you have these big panels that, you know, if you want all over body treatments.
I see.
But it is important to make sure you buy a quality unit, because the power of each light that comes through from each light will determine how effective the treatment is.
Interesting.
And also you need it to be safe. So a lot of units are not tested for safety. And that's another important feature to look for.
And where does one go to learn more about red light? In other words, if you purchase one of these, how do you know how long to put it on your skin? Where do you put it on your skin?
So it depends on the power of the unit, and that's why you should go back to the company you bought it from.
I see.
And they should provide you guidelines on how to use the unit.
I see. Well, thank you so much for sharing more about red light. I really appreciate it.
Thank you.